Good afternoon, everyone, and welcome to the FCCJ, Foreign Correspondents Club of Japan. Thank you for being with us today here in person or online. We are live streaming this event, so please make sure your mobile phones are switched off or in silent mode. My name is Ilgin Yorulmaz. I'm a freelance journalist and also serve as the second vice president of this club. You may have heard in the news the death by Karoshi, Overwork, of a 26-year-old doctor in May last year. Dr. Shingo Takashima had been assigned to a general hospital in Kobe since February that year and was in training to become a gastroenterology specialist. He had been under so much pressure that in just 3 months, his health deteriorated rapidly, and tragically, he took his own life on May 17, 2022. As a resident doctor, Dr. Shingo Takashima had been reportedly complaining about being asked to do miscellaneous work on top of his regular patient care and had little or no chance to take time off for himself. In fact, an inspection by the local labor standards office found that Dr. Shingo Takashima had worked over 100 days straight without a day off, putting in 207 hours of overtime in just until the time of his passing on May 17. Under doctors' work style reform, a new set of government regulations scheduled to take effect from April 2024, doctors in principle cannot work beyond an average of 80 overtime hours a month. Yet the law also allows exceptional cases, which will include certain hospitals, to allow up to 155 overtime hours a month. We have the highest respect for the young doctor and his family, represented today by his mother, Junko Takashima, and his elder brother, who is also a medical doctor, for their courage to speak up on this deeply taboo and difficult subject of losing their son and younger brother, respectively. Joining them is Dr. Kenji Shibuya, to my immediate right, another medical doctor and public health expert who works as the research director at the Tokyo Foundation for Policy Research, a think tank. And until recently, he was also the vice chair of the Ministry of Health and Labor and Welfare's Doctors' Work Style Reform Deliberation Committee. We think we can honor this young doctor's memory the best, not by indulging into the intricate details of his death, but by frankly discussing the measures to prevent a recurrence of incidents like these so that no other doctor loses their precious lives. Dr. Shingo Takashima's family and Dr. Shibuya will make a brief statement, and then we'll open the floor for question and answer. Of course, the medical center, which Dr. Shingo Takashima worked for, is also welcome to come and speak here at FCCJ if they choose to do so. So please.
Thanks, Eugene. My name is Kenji Shibuya, and I will give you a very brief overview of the current status of doctors' work style reform. So as you can see on the screen, in Japan, doctors work exceptionally long hours compared to other professions. In the 2019 survey by the Ministry of Health, Labor and Welfare, around 38% of hospital physicians worked over 80 hours of overtime per month, which is referred to as the Karoshi threshold, highlighting the prevalence of long working hours. Subsequently, in 2022 survey, the percentage decreased due to some of the effort made by the medical community, decreased compared to the previous survey in 2019, but still approximately 20% of hospital physicians exceeded the Karoshi threshold. Additionally, 2021 survey by the Japan Medical Association found that 4% of doctors consider suicide or death every week or every day, indicating a high level of risk. Balancing the health of doctors and the safety of patients is crucial, considering the very unique factors of healthcare profession and the social context. So The reform doctors' working condition in Japan has been under discussion for approximately a year and a half since 2019, resulting in the implementation of various measures, including developing a plan to reduce doctors' working hours and additional health protection measures, such as interview guidance, limits on continuous working hours, and intervals between shifts. However, one critical policy is the special exception for annual overtime work hours, capped at 1,860 hours for doctors. Please note that Karoshi threshold refers to monthly overtime exceeding 80 hours, which translates to 960 hours of annual overtime work. Therefore, annual cap of 1,860 hours for overtime work is exceptionally long. This exception primarily targets hospital doctors in university hospitals and those involved in regional acute care, including emergency hospitals, upon which many private regional hospitals depend for overtime work of these young doctors. So in essence, Japan's healthcare system often operates with hospital doctors' sacrifices. And one could argue that ministry, the policy have effectively allowed the status quo to continue, especially in the context of maintaining regional healthcare. The concept of fulfilling the mission as a doctor in the community and tolerating long working hours, in my opinion, are totally separate issues that require careful consideration. And as Elijun mentioned, that I served as a member, not right now, in 2019, of the Ministers' Committee on Doctors' Workstyle Reform, but I resigned from my position as a vice chair due to my belief that these policy proposals would not effectively prevent Karoshi among young doctors working in university hospitals and acute care hospitals. And it is clear now that my predictions were kind of accurate. So I'll stop here, and I'm going to pass on the mic to the surviving mother. Thank you.
Thank you. どうぞ。Junkoさん。
本日は
Thank you very much for giving me this opportunity to address all of you today. My name is Junko Takashima, mother of Shingo Takashima, and thank you in advance for your kind attention today.
Was my treasure. He was irreplaceable. However, in May of last year, he tragically took his own life. He was working as a resident at Konan Medical Center in Kobe. My son became a victim of Karoshi, and the weight of this loss is unbearable.
In June this year, the Labor Standards Inspection Office ruled that my son's incident was work-related death caused by overwork. Since around February 2022, my son worked from around 7 in the morning till about 11 at night every single day. During the month prior to his death, he worked approximately 207 hours of overtime and did not have a single day off for 100 continuous days. To date, Konan Medical Center has not acknowledged the overwork and has not made any apology. Before his death, my son said, "I can't take a day off. The director issued a notice, so I can't even report my overtime." My son consulted a senior physician, but the senior colleague preached him, saying in a proud manner, "I used to work 20 hours a day and only took 5 days off during a year." My son was exposed to backbiting, bad-mouthing, and reprimand by the senior physicians, which gave him great agony. From around April, he stopped watching baseball games or listened to music, hobbies he used to enjoy, and started to look pale. He said, "My mind isn't working. Everybody is only thinking about themselves, so they can't afford supporting others. Nobody helps me." While being pressed for time in his daily work, my son was also assigned to a series of presentations at academic society meetings. Presenting papers in academic meetings is required to be qualified as a specialist physician, but gathering data, compiling presentation details, and repeatedly asking his supervisor to check and edit the paper would be a major burden for a young resident just getting started with his specialist training. Placed in such a situation, my son got lost and was driven to a corner. I told my son, "Working too hard isn't good for you." But his response was, "You don't need to tell me that. I want time out, but I can't. Can you do something to reduce my workload? I wish everything would be gone when I wake up tomorrow morning." At that point, I should have dragged him home. On May 17th, 2022 at noon, he texted me saying, "I was about to do something very stupid this morning, but I'll try not to do that again, so don't worry." But after that, no matter how many times I texted him, he never responded. This worried me, so I drove to my son's house in Kobe. I rushed into my son's condo, unlocked the door, and found his shoes at the entrance. The room was dark, and I couldn't find him anywhere. I was shocked when I realized that the closet door was left open and there was a bathroom chair that shouldn't be there. There, I found my son being hung with his tie like a piece of clothing. I cupped my son's face with my hands. His body and his face were still warm. I attempted CPR, but my son never came back. He left a suicide note. He wrote, "Mom, I'm so sorry to give you such pain. Maybe there were better options, but I couldn't choose them." It seems he attempted suicide that morning, but had second thoughts and went to work. He worked his regular hours and came home, but in the evening he took his own life. My son was struggling, but I couldn't help him. I am filled with remorse. My son developed depression due to overwork at Konan Medical Center, which led to his suicide. The hospital director told me that my son's workload was not necessarily substantially greater than that of his colleagues, which suggests that many other physicians are also placed under harsh working conditions. In a press conference, the hospital director said that the working hours of the physicians could not be verified and that they don't know the cause of the suicide. We, the family members of the deceased, believe that our son's death was caused by the hospital administrator's disregard for labor laws and have filed criminal charges against the hospital. A director who refuses to admit my son's death as death due to overwork and downplays the incident is in no position to take appropriate steps to prevent recurrence. Overwork at Konan Medical Center is just the tip of the iceberg in Japan. Many other hospitals have similar situations. There have been many Karoshi cases in Japan. Physicians in particular are subjected to the work style that remains unchanged for a long period of time, so they are prone to overwork much more likely than other professions. Japanese doctors are paid low salaries, forced to work endlessly, but their human rights are not protected at all. One of the main reasons for long working hours at hospitals is a lack of shift work. This means that the physicians would have to work for 33 hours or longer from 9 a.m. till 5 p.m. the following day, working the regular hours and being assigned as an on-call doctor at night. This happens several times a month. The reason why regular work must follow without any rest after being the night duty doctor the previous night is because of an exceptional system for the night and day duty permission that allows the hospitals to disregard the working hours at night or during national holidays with little or no work, and that is not counted into the physician's working hours pursuant to the permission by the local labor standards office. However, the conditions for approval by the authority to make the physician work continuously are that there is constantly very little need for medical attention so that physicians can get some sleep. However, under the system, many hospitals do not take into account the hours of labor for emergency care at night and the physician's working hours. Thus, long working hours have become the norm of physicians working at hospitals. In addition, young physicians need to learn many things, including new treatment regimens, but the reality is that even if the assignment was given by the supervisor, it is treated as voluntary self-improvement or skill-up activities in many cases. Studying new methods of treatment or new drugs, preparing for conference presentations required to be qualified as specialists are considered as voluntary skill improvement activities and are not considered as labor in Japan. Even working at a hospital with heavy workload, extensive scope of tasks is treated as voluntary self-improvement measures and not considered as work by the supervisors and the hospital administrators. Young physicians have their career taken as hostage, so they can't oppose or act contrary to the words of their seniors. Even if the manager unreasonably imposes assignments saying this is not part of hospital work, it's for your self-improvement, the young physicians cannot protest. The quality of Japanese healthcare is maintained thanks to the service overtime work of the physicians working at hospitals, but young doctors' salaries are low, so in order to make ends meet, the physicians work at university-affiliated hospitals during the daytime and work part-time in other private hospitals. The issue of on-call duty as well as a voluntary self-improvement initiative is not being recognized in the declared hours of work, serves only to reduce the apparent hours of labor of physicians. And the hospitals don't change at all because of this situation, which is clearly a major issue. If physicians are continually forced to overwork, we cannot protect their human rights. We are going to call on MHLW and the government to improve the working environment of doctors. Next year, the government would get started with the workstyle reform for the medical profession. But the way doctors work in Japan will not improve at all if they are sometimes treated by hospitals committed to voluntary self-improvement when in fact they are working. I'm sure there are plenty of alternatives to replace my son for the hospitals, but for the family, he was a treasure that I cherished and nurtured and shared tears and laughter. We must not allow hospitals to take advantage of doctors' sense of mission to save the lives of people. Clearly, there is a lack of recognition that doctors are also humans to be valued. The high standard of Japan's healthcare system, which allows universal access to medical facilities and medical treatment, is supported by the efforts of young doctors like my son. Still, young residents undergoing specialist training like my son are suffering from overwork. In a 2020 survey on residents, about 30% were working more than 1,920 hours of overtime a year. According to the National Union of Physicians, 14% of young physicians in their 20s have thought of suicide at least several times a week. Every year, doctors die from overwork. If Japanese doctors remain overworked, the safety of healthcare would also be at risk. Is it acceptable for pilots clocking more than 200 hours of overtime a month to fly an airplane? To avoid malpractice and achieve medical safety, physicians must stay healthy. Finally, we lost a family member to overwork. Although our son can no longer save the lives of his patients, we will strive to use his death as an opportunity to improve the problems of the harsh working environment, a challenge he presented to us in exchange for his life. It is our mission to make sure that no more young doctors die from overwork. I hope Konan Medical Center will be reborn as an advanced facility that actively works to improve labor issues among Japanese hospitals under an administrator who has insight into the human rights of physicians. No job is more important than our lives. I strongly hope that death by overwork of doctors will be eliminated in this country. Please, please help us to transform the harsh situation that Japanese doctors are facing.
I had to recount this tragedy in front of everyone, but thank you for speaking up. And would Dr. Takashima like to say a few words, the elder brother of Shingo Takashima?
Thank you very much indeed. I am the elder brother of Shingo Takashima. 18 months has passed since my brother committed suicide, but we would never be able to overcome this sorrow and the anguish that we have experienced. I really hope that Konan Medical Center would be reborn and become a model for this good working environment among the Japanese medical profession. But this has not been realized yet. I really hope that as a result of this incident of my brother, the situation would be rectified so that no family in Japan would have to experience such a pain and anguish in the future.
I think everyone has a lot of questions on their minds, so we'll just begin. But if I may just ask you, maybe Dr. Takashima, how did your younger brother, Shingo-san, decide to become a doctor and choose gastroenterology as his specialty? Can you just explain a little bit, and then we open it for questions and comments? Thank you.
Thank you for your question. My father is also a doctor, and every day he works until late at night, but he is greatly appreciated by many of his patients, and he is respected by many of his patients. And Shingo has seen my father sacrifice himself for the sake of his patients. And so both myself and my brother had seen my father being appreciated by the patients and serving for the patients. And we wanted to be like my father, and my father was actually a gastroenterologist. And so since junior high school or senior high school, he really observed my father using this endoscope for the GI tracts, and he really wanted to be a gastroenterologist, just like his father.
Yes, I would like to open it now for questions and comments. If there are any, please come to the microphone and say your name and your affiliation. If I may start by asking perhaps Shibuya-sensei, let's talk about the overwork issue. First of all, just to make sure everybody understands this clearly, what is the level of overtime beyond which it has the risk of causing karoshi? And also, if I may just recap, the government has, in recent years, in 2019, I believe, introduced a cap of 30 hours a month overtime for most industries, but it allowed double that amount for special circumstances. And you mentioned the doctor's work style reform coming into effect in April 2024 increases this to 80 hours a month, actually. And on top of that, if I have understood it correctly, certain hospitals will be exempted from this list, such as hospitals dispatching doctors to rural areas, hospitals offering high-level cancer treatment or high-level emergency treatment, and also hospitals employing doctors in training, like Shingo, Takashima. Now, I can say from research that about 10% of doctors in hospitals in Japan do more than 155 hours of overtime per month. This is already twice the level that is believed, to cause Karoshi, but please confirm that. It's almost twice. Do you think the proposed reform already fails to solve the problem by still allowing exemptions for overwork that's beyond the Karoshi levels?
So first of all, your understanding of the rules is accurate. And secondly, so responding to your question, so here's the answer. So of course, we cannot eradicate, I would say, all the Karoshis, doctors, but at least we can minimize or even substantially reduce if we make more effort. Because when I was working as vice chair of the committee, so all of a sudden, 1,860 hours cess was proposed. And in the report, if you have a chance to take a look at, or in Japanese, unfortunately, they clearly stated medical community should make every effort so that all the doctors their overtime work should be within the 1960 Karoshi threshold. But obviously, if you set the bar very high, the university hospitals and acute care hospital, which are running short of resources, they may not have enough incentive to change, right? So at that point, in my opinion, they, maintain the status quo, as I said, so that they don't have to drastically change the healthcare system. But as Dr. Takashima's mother clearly stated, the Japanese healthcare system, particularly hospital physicians, their self-sacrifice are the source of, I would say, kind of success of Japanese healthcare. Very cost-effective, very high quality, but cheap. But cheap comes with the price. So I'm not quite sure answering your question, but it's not enough. So, and we will see. And whether it's failed or success, obviously not success. And I don't want to deny the effort made by the hospitals and physicians on the ground. But I will give you an example. After this, recently, university hospital. It was reported at university hospital. I don't want to name it, but they didn't consider the time of hospital doctors spent teaching students or conducting research outside regular hours as part of their official working hours. Categorize it as self-improvement without pay. It was, circulated as an internal memo. So that's what is happening.
Thank you. Any questions from the floor? Yes, and then please state your name and your affiliation.
ラジオフランスとリベラション新聞の特派員で西村と申します。
My name is Nishimura. I am a correspondent of Libération paper. Now, just like the area of education, in the area of healthcare, people who are healthcare providers are very enthusiastic and committed for the children in education, for the patients in medical profession. They keep working and they work overtime. So even if the law in this country would limit the overtime, I think there is a danger of just becoming service overtime. So maybe the number of people to be limited working overtime would be better. So as a doctor and as a mother of the deceased doctor, what are your feelings and reaction? Thank you very much. As a doctor, we have to save the lives of the patients. We have to, in order to do that, improve our medical skill. We have to keep up with the advancement of medical technology. And so we have this very strong desire, yearning to save the lives of the people. And this was what supported the Japanese healthcare system. But in the background, many young doctors like my brother had sacrificed their lives. So I believe that it's much there is room for medical institutions to protect these physicians, like the nurses' working style, to promote shift work and try to really get rid of service work, service overwork. That can be conducted immediately. However, trying to reduce the apparent working hours by the hospital is the top priority. And so the doctors working in the field do not take this up as an urgent issue that has to be transformed. And this leads to the death by overwork of Japanese doctors. And the fundamental issue is that against the number of beds in Japanese hospitals, the number of physicians are not enough. So, of course, these situations would have to be corrected, but there are some impediments that the government would have to overcome in order to come up with a comprehensive solution. But as I said earlier, there are things that the hospital can start doing immediately to rectify the situation. And I really hope that MHLW would take initiative to get started. Even today, I think they can get started.
Ask in Japanese. 日本語で質問いたします。
Let me ask my question in Japanese. Thank you very much. And as explained by Dr. Takashima, the number of physicians are not enough. I think this has been a chronic issue in Japan. So up to now, the shortage of physicians has not been resolved. So if the number is not enough, it's really difficult to try to increase the number. I think there are certain reasons the physicians' number are still of great shortage. Can you explain to us the situation and the reason why there is this shortage?
Japan Medical Association first. Because the issue of increasing number of doctors and also task shifting the medical practices to nurses, caregivers, have been discussed extensively when I was also engaged in this committee. And there are some examples where the nurses and caregivers could do without supervision of doctors, for example, inserting catheter. So it's happening, but for example, setting up the nurse practitioners or other types of new entity would threaten the limited resources going to the medical community. So it's a kind of a trade-off. Everybody knows that doctors are doing so many things where other professionals could support more. And also the issues about digital transformation or simple, digitalization. I will not say transformation because transformation is a complete change. The simple digitalization has not yet been happening because there is limited incentive for the hospital to do that. So on top of that, a fundamental issue is about the structural conventional and cultural factors where there is a hierarchy of the medical community, and also try to stick with the status quo. So I'll stop here. So I pass on to the brother.
If I may just add to this a question which came online, which is closely related to this. This is from Rocky Swift from Reuters. His question is, part of the problem seems to be a shortage of doctors and nurses in Japan. Would Japan ever seriously consider recruiting foreign-born doctors in the way that is common in the US and Britain? So both maybe. First.
You mean seriously? I don't think so. Because
why? Yeah.
Because medical, yeah. So I'm happy for foreign doctors to practice, for example, foreign patients. But again, the same thing. If you don't protect the territory of the medical community, your profit or your stake will be given to others. So it's a simple mathematical equation. To make it simple.
Please.
ありがとうございます。
Thank you for giving me the turn to respond. Well, if foreign doctors start working in Japan, there would be a succession of surprise and shock because doctors would not be counted as working hours when they are even working in hospitals, observing the patients, studying new pharmaceutical products. These are all recognized as voluntary self-improvement tasks. It is not taken into account as working hours. So unlike the foreign medical profession, attending these academic meetings, presenting papers, and improving your skill set, these are not considered as work in hospitals. This is considered as voluntary self-improvement. So I'm really sure that foreign doctors would be shocked. At 5 p.m., you can't go home. There is no shift work. And of course, you can't really transfer your workload to your colleague. You have to keep up at midnight, but you have to keep working in the following day. So starting at 9 a.m. in the morning and continue to work until 5 p.m. the following day, not the same day, but the following day. Have you ever experienced that in other countries in the world? I think this naturally leads to death by overwork. But of course, there is this globalization of various industries in the country, and we have to really become globalized and accommodate foreign doctors. We have to do more to protect the physicians, including foreign physicians. So it's like driving under influence. It's really risky at the moment when we consider the situation in medical profession.
Foreigners, the cultural work in Japan is part of the problem because it's a virtue to overwork and it's frowned upon to ask for compensation for your overwork, I guess. So, yes, there's another. Thank you.
はい、ありがとうございます。
Thank you very much. I am a correspondent, Isang, from Korea. So, from the eyes of a foreign media, you said that we would be surprised, but I was not surprised. This situation is not just in Japan, but exactly the same situation in Korea. There is death by overwork and very cruel and harsh working environment in Korea as well. Korean physicians experience this as well. So today we're talking about the need to protect the lives and human rights of Japanese doctors. But the situation is similar in Korea as well. So maybe with Korea, the United States, or the European countries, maybe there is a need to go into international collaboration. Oh, I'm very sorry, I didn't know about the situation in Korea, but maybe Japanese physicians and Korean physicians have this misunderstanding that it is virtue to overwork. But the original target probably was not to overwork. What do you learn and what can you contribute by learning and what can you return to the patients in the medical practice? I think in Japan, as well as perhaps in your country, there is this implicit pressure from your supervisor that you cannot go home before your supervisor. And so there is excessive consideration that you give to your surrounding, and that may lead to overwork. So if this is not a problem in Japan, then maybe the protection of the human rights of physicians is lacking in Japan as well as in Korea, and this would have to be really emphasized on this global scene.
Yes.
再びラジオフランスとリベラション
Once again, a question from Libération paper. I was hospitalized in a university hospital in Japan. The doctors, the nurses were full of smiles. And looking at their facial expression, I was never able to really consider that they were placed in a very difficult situation. So in order to communicate how hard the problem that they encounter isn't there any way to effectively communicate? There was an example of Korea cited, but let's say in France, you really go into a strike that your working hours are too long. So you walk out, and there is this strike that is staged. So isn't there a way in Japan to clearly communicate the hardships that the doctors are really faced with? So press conference is one method, but any other way? Thank you very much for making a very good suggestion. Yes, I think this is a major issue. Until my baby brother died, I didn't really understand what was the work for me and what was the voluntary self-improvement. I really was concentrated on the need to save the lives of my patient, and I didn't really know myself the amount of salary that I received from the hospital. So the physicians themselves, yes, sometimes think that it is virtue to keep working. So of course you get exhausted and you want to go home, but maybe you would become afraid of the stigma that you would receive in the hospital, being a young physician but going home daringly before your senior physician. So it seems that there is this atmosphere that would not allow the young physicians to speak up. And that is because we have never been educated of the importance of labor and labor law. And so if you are to become a doctor going forward, the young students maybe would have to be taught sufficiently of labor management and how important you have to control the way you work in the hospital is. And sometimes there is this atmosphere in the hospital that you only think of yourself and you would let the others work harder if you think it is the limit of what you can do. So labor training or labor management training, grassroots activity, I think, would have to be strengthened more.
To that, actually, I also have had the experience of having colonoscopy in a Japanese hospital, which was perfect, high level, and so inexpensive compared to others. So I had never thought in the background, this was the real case. But if I may just ask, what are your expectations, maybe Shibuya-san and our doctor here, beyond maybe the doctor's life work style reform, how can the public's attitude change, for example, so that they do take time off their work and bring their, sick ones to visit the hospital in work hours? Because I think that's also the problem. They choose outside hours or weekends because it's convenient for them. So I think they should learn, perhaps, that there is some inconvenience visiting the hospital.
Thank you for your question. So Japanese healthcare is like really 24/7, like a convenience store. And so this is the virtue and also the weakness of the Japanese healthcare system, because this is supported by these young doctors who have to be sacrificed. And so we are taught we have to be fully accountable to our patients, that we have to definitely avoid malpractice, that we have to make sure that advanced medical technology would have to be provided. And with this, the Japanese physicians are really up to their capacity. And sometimes considering the hourly wage, maybe the people working in the convenience stores earn more than the young physicians, because if you have the emergency care in the hospital, they come to the hospital for at ER during at nighttime, and sometimes people say, I have insomnia, I can't sleep, and they visit the ER, and sometimes they say they have this 2 weeks of constipation, and they seek ER emergency care. Of course, it is important to really treat these patients. But what about the health of these doctors in the ER? Have the patients ever thought of that health?
Sounds question about why don't we do strike? But this is a beginning of a mini strike, right? So speak up, because it's very difficult to speak out among the medical community, because everybody knew this for a long period of time. Similar to the examples of entertainment business, like Johnny's or Takarazuka, the same thing. Everybody knew. But unless the media reported, Japanese community remained silent. So I need your help as well. And also, when we talk about reform, sounds like a very, very hard thing, but according to our supporter, work-life balance people, the simple thing, for example, avoid lengthy morning conferences, evening meetings, these, or, stop, creating lots of slides for conferences for credit. That kind of simple measures will work very well. So I think we really need to nail down to more understanding that work-style reform will enhance productivity and also beneficial to the hospital, because currently the management team of the hospital tend to think that, oh yes, ministry is saying this, or government is saying this, and this is a legislation, we have to do this. But this kind of reform will not work.
Yes, you do.
Kakuchi from University World News. I'm wondering whether there is any movement among patients. Are they trying to bring this up? And also, I still want to bring up the foreign doctors issue. I mean, finally, they're opening up to foreign caregivers. And is it possible for foreign doctors to work in Japan despite the language barrier?
Okay. I'm 100% supportive of your proposal. I have been arguing that the foreign doctors or those, working for Japan should be welcome. But, and I have been still arguing for that kind of movement. And what was your first question? Patient, yes. Simultaneously with this reform committee, we had another committee on how the citizens support and wisely utilize the healthcare system. and where the patient group come together and media and argue how we harness and protect the healthcare systems and doctors from patient and also general public perspectives. For example, as Dr. Takashima mentioned, everyone could go hospital anytime. Of course, there is an exception right now. For example, at the time when you have symptoms of flu, they go to get tested to submit to their company. But when I was in the UK and I had symptoms of flu and I'm convinced I have flu and I asked the NHS whether I could visit, don't come. And your appointment will be 3 weeks later, well, that kind of stuff. So there is a convention that, as Dr. Takashima mentioned, that the Japanese healthcare is a convenience store. So we may need to, rethink about how variable this system would be. And I will stop here. But in the first page of this doctor's reform, workstyle reform, the first sentence is, I remember I wrote it. First and foremost, it is essential to share the recognition that our country's health system is being sustained through self-sacrificial long working hours and is currently in a critical state. I wouldn't like to change the statement because that still holds.
Thank you. Yes. Can you stay a couple of more minutes, maybe, because there may be some more questions. Please. Thank you.
My name is Peter Morris. I'm actually a lawyer, but I write articles on Asian Times concerning Myanmar, and I am not fluent in Japanese, so I would like to ask my question in English.
Hospitals have the biggest problem, but I'm just wondering about like the other types of hospitals, whether it's, just generally speaking, like public hospitals, private hospitals, maybe even clinics, like to what extent do they have these kinds of problems, and why are there differences between them? That's one thing. And then if you have time, I'm also curious about sort of the larger labor rights movement or Karoshi movement. Are you guys part of that larger movement? Do you cooperate with other groups, or are you just trying to strategically focus on doctors because maybe you think that's more effective or something like that?
Either one of you, どうぞ。
ありがとうございます。
Thank you for your question. I think this relates to the question that was raised earlier. Now, the hardships and the dire situation of the physicians are not recognized by the public in Japan. So this requires advocate movement. Every year, many doctors die of overwork, but the number of cases ruled by the labor standards monitoring department is very limited. Now, I work also at a university hospital, and in this university hospital, the working hours surely are restricted. And, or rather, the overtime work is to be limited by the university hospitals. But the official activity got started 4 years ago, but it is not showing any visible effect. Now, in private hospitals or in general hospitals, I believe that the overtime is not restricted effectively. Because there are these missions given to the regional hospitals that they would have to save the people in rural areas, that they have to support the regional healthcare system. So rather than having the practitioners working at university hospitals being involved in a strike, there are many doctors who want to continue learning and continue working, and they are not willing to really walk out. So there are still many doctors who are not necessarily advocating the need to reduce the overtime work. And maybe this led to a situation that forced my baby brother to commit suicide. So many people in the hospital, the doctors keep working for many, many hours, and they are totally exhausted. And I think the situation is much worse compared to the situation in other local hospitals. But not all the doctors in these hospitals do not think that they want to quit this, that they don't necessarily think that this is a bad thing because they are not fully aware.
Questions? Karine has a third question. If there's no one else, please, I'll allow her a third question. Very unusual, but I'm sure it's worth it. Thank you.
すいません。確認ですけれども、
So, I'd like to confirm. So, the Labor Standards Inspection Office ruled that this was Karoshi, that there was death by overwork, but there was this inspection by the police. So, from Konan Medical Center, there seemed to have been a whistleblower notifying that there is this terrible overwork situation to the Labor Standards Inspection Office. There was a whistleblower even before my brother took his life. And so if Konan Medical Center was fully instructed by the Labor Standards Inspection Office before this tragedy, my brother didn't need to take away his life. Now, in other hospitals, still there are probably young physicians who are suffering. So, MHLW and the Labor Standards Inspection Office should not be fearful of this hospital environment, but to be very, very aggressive in trying to prevent the incident. So, if there was this investigation carried out by the authority that would lead to like police investigation, and there is this, if the hospital is criminally liable, I think it would be possible to force the hospital to really change the situation, don't you think? Well, it is going to change going forward, but currently, what is the actual number of hours being worked and what is the number of hours of overtime is not really understood and identified by the doctors as well as the hospital authority. So even if there was an investigation carried out by the Labor Standards Inspection Office, they don't have the record of working hours because of this voluntary self-improvement. And so the Labor Standards Inspection Office carried out this inspection, but maybe, I'm not really sure, but they were reluctant because if it imposes penalty on the hospital, then the physicians working in the hospital would have to be reduced, which means that the patients would be sacrificed. But to prevent incidents like this, I believe that there has to be this robust control imposed on the working environment.
Question to Junko-san, if possible. Junko-san, what would make you feel that justice has been served? What would make you feel? What happens and you feel justice is served?
So, how would the hospital director change his attitude? Well, I thought it's a simple thing. To first apologize and commit to implementing measures to prevent recurrence. So the study that he needed to conduct, self-improvement, was not really what my son was able to do because he was driven into a corner. And for a month or so after my son took away his life, I was really, I should say, soaking wet. And I was placed in this pitch darkness. But many people gradually offered me an umbrella to avoid this rain and also the harsh wind that blew against me right after my son's suicide. And many people extended great warmth and support. So when I think of what happened 1.5 years ago, I am very grateful. Shingo really wanted to be a kind specialist in medicine, and he was really interested in this profession. He wanted to be a good doctor. He no longer can make this a reality, but we shall never stop raising our voice so that we can protect the young doctors going forward. I think this is really this ultimate realization of what Shingo used to say. I want to be a very kind doctor.
Takashima, mother of Dr. Shingo Takashima, brother of Shingo Takashima, Dr. Takashima, and Kenji Shibuya. Thank you very much for being with us today.